Hello friends, in today's session we are going to see a very important topic in the first MBBS anatomy, and that is axilla, its boundaries, the contents, and axillary artery, one of the important LAQs. We'll see the basics and how to remember, how to get to the core of this axilla. Okay, let's start. See, axilla is a truncated cone. It's a space bounded by upper part of the arm, the medial side of that, and the upper part of your thoracic wall and surrounding shoulder muscle on the front side as well as on the back side. So it has basically four walls: the anterior, the posterior, the lateral, and the medial. And this is your axilla, a truncated cone, meaning that it has a apex and it has a base. So the apex is formed by this bone which are underneath this, covered by the skin, the clavicle, the scapula, and some part of your adjoining part of the humerus, which they don't say it is there, but it is the lateral most boundary. So scapula, upper border, the clavicle, the first rib which is there, it also forms the upper part of the axilla, and this is the apex. The base is formed by the skin that is covering the floor of the axilla, or the base of the axilla is formed by this axillary skin and the fascia which is deep to that skin. So this is the base. Anterior, again the posterior wall, the lateral wall, and the medial wall. You can see all over they are covered by the skin. Obviously when you remove the skin you get the actual boundaries, which are the muscular boundaries. So this is a muscular fold, this is again a muscular fold. The lateral wall have a thin muscle component there which are getting from the coracoid process to the arm, and you have medially again the muscular component of your thoracic wall. So this is what your axilla is, and you can feel your axilla for just to get to the what is axilla and what it should contain. And that is our next theme, that is what is exactly the boundaries and what muscles actually form the boundaries. So quickly we'll go through the muscles. Anterior wall is formed by the pectoralis major, pectoralis minor with the covering skin and fascia. Posterior wall is in the upper part formed by the subscapularis, then the teres major, then the latissimus dorsi. Remember the posterior wall, though in the middle we say teres major, its lower margin comes below the latissimus dorsi, and hence the teres major forms the inferior most portion of your posterior wall. So you can see that the fold is formed by the posterior wall, the teres major. So medial wall has the upper thoracic wall with the serratus anterior muscle, and it also have that nerve supplying that nerve to serratus anterior or the long thoracic nerve. So this is all your medial wall. Lateral wall is bicipital groove with the overlying coracobrachialis, and you have short head of the biceps. I hope you have covered the scapula, and coracoid process giving origin to these two muscles. They go into the brachium, upper part of the brachium, and this is actually the muscular lateral wall. Okay, many books will only mention the bicipital groove, okay, but it also have coracobrachialis and short head of biceps, brachii muscle, which is there in the lateral wall. Now see, apex is cervico-axillary canal, that is communicating your neck with the axilla, and that is formed by the shoulder bones. I have categorically written it as a shoulder bone, and I have already explained you what are those. The clavicle, the upper part of the scapula, the upper part of your humerus, and the outer border of the first rib. They're all forming that apex of the axilla. The base is from the skin of the lower part of the axilla, that is your base of the axilla. And if you remove this, you will see the content. Okay, now see, in the exam you will have 2 marks awarded for the walls of the axilla if itself the axilla is a LAQ. So this is apex. अगर apex ये है तो ये हो गया broad base, and this is a cone like appearance of your axilla. The medial wall, the lateral wall, you have the anterior wall like this formed by the pectoralis major minor, and you have the posterior wall like this. Okay, in the upper part there is no gap between these walls, heavily muscular part, upper part of the axilla, and in the lower portion you may have some skin folds communicating with each other. Okay, so lateral wall is bicipital groove with the coracobrachialis in the biceps brachii short head. Okay, subscapularis, teres major, latissimus dorsi, they form the posterior wall. The base is all over formed by the skin and the fascia. Okay, the skin and the fascia, that is the axillary fascia which is there. Medial wall is your serratus anterior with the intercostal muscles of the upper 3 to 4 intercostal spaces, so this is what you should draw in the walls of the axilla, though it's difficult to draw, but you can try to draw it, and you will be securing your 2 to 3 marks in your LAQs. Why axilla is important is because it contains a lot of things in that armpit. Okay, the armpit has abundance of contents, mainly a big artery, a big vein. There is a group of lymph nodes which are very essential for examination. There are important nerves which are controlling your upper limb. You also have fat, you have skin, fascia, abundant of hair follicles which are there. So everything is there in the content of the axilla. This particular slide is of 2 marks. Remember, you have to mention these contents in the contents of the axilla and you get the 2 marks. Axillary artery, axillary vein, brachial plexus which is surrounding that axillary artery, mainly axillary fat, axillary fascia. You also have axillary lymph nodes, important content. And there's a lateral branch of this, cutaneous branch of this second intercostal nerve, and that is intercostobrachial nerve. It communicates with the nerve of the cutaneous nerve of the arm, and they supply the floor of the axilla. This is also you find embedded in the axillary fat. So remember all these contents that you will be dissecting very soon the axilla, and you will be able to see this. ये सब दिखता है. Okay, now this is what we have in the axilla, and again you can draw this kind of diagrams in the examinations. Okay, see, this is medial wall, this is lateral wall, this is our floor or the base of the axilla, and this is the apex. You can see axillary artery, medial to that you will see the axillary vein. You can see a lot of nerve plexus there which is known as brachial plexus, and all of you again must be knowing this, and if not, we will be having a separate session on the brachial plexus. So brachial plexus is an important one, but this is a nerve plexus that supplies your upper limb, and that comes from the neck all the way into the limbs, and it wraps around this axillary artery in a peculiar way that forms its structural component. Okay, and this is all embedded in a sheet called as axillary sheath. Okay, this green color sheath is the axillary sheath. So this is axillary artery surrounded by the axillary sheath. Wrapped inside you also find few nerves, big nerves that supply your upper limb. You also find a big vein accompanying the artery, that is axillary vein. You will have the branches of those or the tributaries of these two great vessels of the upper limb. You will find a lot of fat while you dissect the axilla. You will be observing this fat, and embedded in that fat you will have few lymph nodes which are green colored structure, that is shown. We have a designated color of the green, that is to the axillary lymph nodes. So make sure you draw this diagram to get full marks. Okay, just to make you understand where the axillary artery is there, how it begins, we have a hand drawn picture and a short video to observe that. You can observe the axilla there. Okay, and this is the location of the axilla, the armpit. You have the axillary artery running across it. From the outer border of the first rib, you will have the artery running till the end of the axilla, and this is a continuation of this subclavian artery. In this zone, it continues as the axillary artery from the outer border of first rib to the teres major lower border. Okay, this is your axillary artery. You can see the arch of aorta giving rise to the brachiocephalic trunk on the right side that divides into the subclavian and the common carotid, and this is your axillary artery continuing down as the brachial artery. Okay, so this is where you have the location of the axillary artery, and it has three parts here. So this diagram particularly shows you how the axillary artery is a continuation of subclavian, how the brachial artery continues as continuation of the axillary artery is a brachial artery downwards. So this is what you have in the axillary artery location, if you have to know the basics of this, right? So this schematic diagram, it's a hand-drawn diagram that will tell you exactly axillary artery, its course and its extent through the axilla. I can see this is our axillary artery, continuation of the subclavian artery, and further it continues down as the brachial artery. But what is the landmark that defines the margins of or the location of this artery is the outer border of the first rib. Then it is called as axillary artery. It changes its name here at the outer border of first rib. Then it courses beneath the pectoralis minor, which divides this artery into three parts. Proximal to the muscle, first part. Behind the muscle, deep to the muscle is the second part. Third part lies distal to the muscle. So this is 1, 2 and 3, that is the three part of the axillary artery. It's very important that you understand this concept of division of the axillary artery by the pectoralis minor. It's a famous MCQ, pectoralis minor dividing the axillary artery into three parts, and you can see that the lower border of the teres major forms the inferior margin or of this axilla. That is the inferior landmark where this artery changes its name into the brachial artery. This is again a MCQ, outer border of the first rib. Before that, the axillary artery, it is the subclavian artery. The subclavian artery continues into the axillary artery. So remember this division of the axillary artery by the pectoralis minor into the three parts. Now this is again important slide for the exam, because this will carry 2 or 3 marks again depending on your exam. Okay, it may be only the thing asked in particular brief answer or short answers. What are the branches, or the enumerate the branches of the axillary artery. The first part gives only one branch. This is the superior thoracic artery. This is the superior thoracic artery. This is your first part. Second part gives acromiothoracic or thoracoacromial artery, lateral thoracic artery. These are the two branches given by the second part of the axillary artery. The third part gives three branches. The subscapular artery, it is the largest branch of the axillary artery. Again a very common MCQ that is asked repeatedly, and even in the vivas you will find it useful to know this fact that subscapular artery is the largest branch of the axillary artery. The fifth branch is the anterior circumflex humeral artery, comparatively smaller as compared to the posterior circumflex humeral artery. This is larger, and this will encircle around the surgical neck of the humerus. They will form anastomosis there. They will supply the shoulder joint. All these arteries have the distribution, and it is mainly, many of the arteries in the name itself, they suggest what do they supply, or their location. Superior thoracic artery supplies your pectoral muscles and the upper part of the thorax. Acromiothoracic further divides into 4 branches: pectoral, deltoid, clavicular and acromial. and it supplies the similar region, like the pectoral supplies the muscles. The deltoid will go into the deltopectoral groove, supplying those muscles and surrounding structure there. The clavicle is supplied by this clavicular branch. It also goes to the margins of the acromion, and this is acromial branch participating in that anastomosis around the shoulder tip or the acromion process. So this is acromial branch. Lateral thoracic supplies mainly the thoracic wall, and in the female this is a significant contribution to the mammary gland. So mammary branches coming from the lateral thoracic artery in the females, they are particularly developed. This artery is again may anastomosis with the artery of the abdomen, okay, the superior epigastric artery. It may have few communication with that artery, but in the upper limb you need not to worry about that. You just remember lateral thoracic artery supplying the lateral part of the thoracic wall, and the also contributes to the mammary gland blood supply. Subscapular artery, largest branch supplying, or it is given by the axillary artery, and it runs along the posterior wall of the axilla, along that margin of the scapula, lateral margin, and it gives around the lateral margin a very big branch, even bigger than the stem branch, that is subscapular artery का branch जो होता है, this branch is called as circumflex scapular artery, is larger than the parent artery. Many of the time you will have variation in the origin of this, but this is largely the pattern of origin of the arteries from the axillary artery. And the circumflex scapular artery supplies the infraspinous fossa, the supraspinous fossa, even the subscapular fossa, and it anastomosis with the some of the branches of the subclavian artery, particularly the transverse cervical artery, okay, giving a superficial and the deep branch, and this forms the one of the part of the anastomosis around the scapula. This artery further continues as the thoracodorsal artery, accompanying your thoracodorsal nerve or the nerve to latissimus dorsi and supplying your latissimus dorsi muscle. This is already explained that circumflex humeral arteries are supplying your shoulder joint and the structures around it. Your posterior circumflex humeral artery is also a component of your quadrangular space, which is along with the axillary nerve. This will be present there, okay. So this diagram particularly is important, and this is a schematic of your branches of the axillary artery. Just for the enumeration you will have this superior thoracic artery, first branch, the first it arises from the first part of the axillary artery, thoracoacromial artery, lateral thoracic artery. These are the two branches coming from the second part. Subscapular artery, the largest branch coming from the axillary artery, but it is third part branch, and anterior and posterior circumflex humeral artery, okay. So if you know this, you'll be carrying through nicely from the axilla. Now many of the students they are confused about the relations initially. What are the exact relations of the axillary artery and how to remember it? Because in a LAQ they will be definitely asked for 2 or 4 or 3 2 to 4 marks. This diagram will help you to understand this. You have to understand first the directional arrows. This is your medial direction, this is your lateral direction, this is your posterior direction, this is the anterior. Anterior here means superficial part, posterior here means deep part, medial is medial, lateral is lateral. Lateral is away from the body towards the humerus, and this is towards the chest wall, okay. Now obviously your axillary artery have very important continuous medial relation, and if you write this you will be definitely getting 1 mark. Axillary vein is always present medially. So in the time of emergencies, many of the students don't remember anything. You please remember at least one relation. Medial relation of the axillary artery is axillary vein, and that will secure 1 mark for you if you just draw this two structure. Always remember there is anteriorly pectoralis major, and in the second part you have to add the pectoralis minor deep to the pectoralis major. And the third part, initially you can draw even pectoralis major, and later on you will only have skin and the fascia. Though it's not drawn here, you will always find skin and fascia in the anterior part of the anterior relation of the axilla, because you already know that axillary boundaries, these muscles are there and they are all covered by the skin and fascia. Remember this. Posterior relation serratus anterior in the first part. This is what lies deep to the first part. In the second part, in the upper part of the axilla, you have subscapularis. So this will form the posterior wall in the second part of the axillary artery. So this is the bed forming muscle. In the third part, lower part of the axilla, you will have latissimus dorsi and teres major contributing the posterior wall. Now this is very important relations, because if you understand the axilla posterior wall, this is a cakewalk. This is very easy to remember. Serratus anterior in the first part, which is actually the medial wall of the axilla, but it becomes the posterior relation of the first part. Subscapular is the upper part of the axilla, but it becomes the posterior wall of the second part of the axillary artery. Teres major, latissimus dorsi, the lower part of your axilla, posterior wall, and this is forming the posterior relation of the third part. Now the confusion lies in the relationship of the nerve plexus called as brachial plexus, and you will notice significant difference in those relations. But if you master your brachial plexus, this is very easy again. There are few cruxes to remember, like there are only 3 chords of the brachial plexus, and you have to remember their name, and you start from the second part to understand. This is the easiest one, because in the second part the artery medially is related to the medial cord of the brachial plexus, posteriorly this is related to the posterior cord of the brachial plexus, and laterally it is related to the lateral cord. If you know this, you are through, because this is the basic. The second part, the cord relation, is the most easiest one and the significant one and the milestone one. Okay, second part, medially medial cord, laterally lateral cord, posteriorly posterior cord. That is that much easier. Now what is happening in the third part is just the splitting of these cords into few of the branches that you have to mug up, that you have to understand in the brachial plexus. Posterior cord branches, medial cord branches, that's it. Nothing more easier than this. Lateral cord branches, you have musculocutaneous nerve, the lateral pectoral nerve, the lateral root of median nerve. Posterior cord branches, the axillary nerve, the radial nerve. Medial cord branches, the ulnar nerve, the cutaneous branches of the arm, forearm, and you may also have medial pectoral, but it arises a little bit earlier. So threads of that nerve can be there. See, depending on the books, 1 or 2 nerves may vary here. Some may show the cutaneous nerves, some may not show the cutaneous nerves in the third part, but more or less they are there. Ulnar nerve always just in the groove between this artery and the vein. A big nerve is ulnar nerve. So no marks will be cut for the cutaneous nerve, but if you miss out ulnar nerve, if you miss out the radial axillary, if you miss out the musculocutaneous, the marks will be cut. And remember, median nerve forms anterior to the artery. So this is in the anterior relation of the third part of the axillary artery. Now the confusion part is here in the first part. How is the arrangement of the cords? So remember, there is a 90-degree rotation to the medial side to these 2 cords, medial and cord, as they go to the second part. Lateral cord never changes its position. Lateral cord is always in the lateral position. Medial cord is initially posteriorly, then it rotates to the medial side. You can see here, medial cord going to the medial side. Initially it is posteriorly. So The names of the cords are as per their position in the second part of the axillary artery. How they are related? First part, they have a change in the position because of the obliquity of this axilla. The medial cord is related posteriorly to the first part, and posterior cord is related laterally to the first part. Lateral cord is always lateral to the axillary artery. So these are the relations of the axillary artery. I hope you'll be understanding this. If not, if you want more elaborations, type into the comments what part you don't understand. Okay, so this relationship of the artery is important, and when you finish of this, you have to write the clinical anatomy. Why? Because you will lose important 1 or 2 marks, in your exam. Even if it is not asked, it is better, it is customary to write 1 or 2 points of the clinical anatomy in each of the short note, each of the the long answer questions. You can feel the pulsations of the axillary artery along the lateral wall of the axilla. What did I say? In the lateral wall of the axilla, because of the firm support of the humerus, that you can feel the pulsation of the axillary artery along the lateral wall of the axilla. And central line for many of the important surgeries is put through the axillary artery. Okay, because you don't want the cannulas to come out at the crucial junctures in this surgical procedure, where you may land your patients into the trouble. Axillary lymph nodes are very important. Lymph node as sentinel lymph nodes for the breast carcinoma, meaning that you will palpate, you will be able to palpate the axillary lymph nodes initially. They may tell you that yes, there is something wrong in the mammary gland. Okay, they may be enlarged in the infections of the upper limb, some problem in the upper limb, some bones, some muscle, some connective tissue. But breast carcinoma, where it is one of the commonest cancer in the females, they are particularly significant. Axillary sheath is a derivative of your prevertebral layer from the neck. It wraps around the axillary artery and even the brachial plexus. Okay, axillary vein is considered to lie outside the sheath because it allows the distinction of the vein by just being separate from that vein. So vein is devoid of any fascia. Vein needs to expand, but the artery is well covered, well protected in this axillary sheath. It's a derivative of the neck fascia called as prevertebral fascia. Another MCQ repeatedly asked in the exams. Okay, axillary sheath. Collateral circulation around the scapula. I have already discussed how the third part of the axillary artery, the circumflex branch of the subscapular artery, and the transverse cervical artery, giving its superficial and deep branches around the medial margin of that scapula, anastomos with this each other. So third part of the axillary, third part of the subclavian. Why you need anastomosis? Because again, if there is an accidental cut, if there is an accidental block into the any of this artery, they can compensate each other because they supply your shoulder. A very important aspect of the human being is the upper arm, or we say upper limb. Without the upper limb, we cannot perform anything significant motor skill. So yes, they are supplied with the collateral circulation. In the time of emergencies, your axillary may compensate for the blockage in the subclavian, and your subclavian may partially be compensated by the axillary in the times of the need. Okay, so this is what is the collateral circulation. I hope you have understood the axilla. Keep watching the videos for more understanding, deeper understanding, and what is important for your exams. I'll be giving intermittent tips for that. Okay, enjoy the day.